Top 10 health problems common in cats. As loving cat owners, we want our furry friends to live long and healthy lives. But what are the most common health hurdles they face? Let's explore the top 10 health problems prevalent in cats so that you can be informed and proactive in their care. 1. Obesity. Obesity is a prevalent health issue among cats, affecting their overall well-being and leading to a variety of serious health complications. A cat is considered obese when it weighs 20% or more above its ideal body weight, which can significantly shorten its lifespan and increase the risk of conditions like diabetes, arthritis, heart disease, and respiratory issues. Factors contributing to obesity in cats include overfeeding, lack of physical activity, and, in some cases, underlying health problems such as hypothyroidism. Cats are naturally inclined to be hunters, so engaging them in regular play and exercise is essential to help them maintain a healthy weight. Diet plays a crucial role. Feeding your cat portion-controlled meals of high quality, nutritious food can prevent excessive weight gain. Many cat owners may not realize that treats can also contribute significantly to calorie intake, so it's important to offer them sparingly and consider healthier alternatives. Regular veterinary checkups can help monitor your cat's weight and provide tailored advice. If your cat is overweight, a gradual weight loss plan prescribed by your vet is generally the safest approach, promoting healthy lifestyle changes that include both diet and exercise, ensuring your feline friend lives a longer, healthier, and more active life. 2. Dental disease. Dental disease is one of the most common yet often overlooked health problems in cats, with studies indicating that a significant percentage of cats over the age of 3 exhibit some form of dental issue. The most prevalent condition is periodontal disease, which begins with the accumulation of plaque and tartar on the teeth, leading to inflammation of the gums, gingivitis, and, if left untreated, can progress to tooth loss and severe oral pain. Cats may not always show obvious signs of dental discomfort, making it crucial for pet owners to be vigilant. Symptoms can include bad breath, reluctance to eat, drooling, and pawing at the mouth. Regular dental care is essential, which includes not only professional cleanings performed by a veterinarian, but also at-home care, such as brushing your cat's teeth with vet-recommended toothpaste. Additionally, dental treats and toys designed to reduce plaque buildup can aid in maintaining oral health. The connection between dental health and overall well-being cannot be overstated, as bacteria from periodontal disease can enter the bloodstream, potentially affecting the heart, liver, and kidneys. Therefore, early detection through routine veterinary checkups and proactive dental hygiene practices is vital in preserving your cat's health, preventing pain and complications, and ensuring they enjoy a happy, pain-free life. 3. Kidney disease. Kidney disease is a significant health concern for cats, particularly as they age, with chronic kidney disease being one of the most common conditions diagnosed in older felines. The kidneys play a critical role in filtering waste products from the bloodstream, regulating hydration, and maintaining electrolyte balance. So when they begin to fail, the body struggles to perform these essential functions. CKD often develops slowly over time, making early detection challenging. So regular veterinary checkups are crucial for monitoring kidney health. Symptoms of kidney disease may initially be subtle and include increased thirst and urination, weight loss, decreased appetite, and lethargy. As the disease progresses, cats may also exhibit signs such as vomiting, poor coat quality, and even dental disease. Diagnosing kidney disease typically involves blood tests to measure kidney function and urine tests to assess urine concentration and protein levels. While there is no cure for CKD, early intervention can help manage the disease effectively. Treatments may include dietary changes to lower protein intake, fluid therapy to prevent dehydration, and medications to address specific symptoms. Providing a specialized kidney diet that is lower in phosphorus and higher in certain nutrients can also help slow the progression of the disease. As kidney disease can significantly impact a cat's quality of life, maintaining a close relationship with your veterinarian and observing any changes in your cat's behavior can greatly aid in managing their health and ensuring they receive the best care possible. 4. Hyperthyroidism. Hyperthyroidism is a common endocrine disorder in cats, particularly affecting middle-aged and older felines, and it occurs when the thyroid gland produces excessive amounts of thyroid hormone, which accelerates the cat's metabolism. This condition is often caused by benign tumors on the thyroid gland, known as adenomas, which can lead to a range of alarming symptoms, including increased appetite, dramatic weight loss, excessive thirst, increased urination, hyperactivity, and behavior changes, such as restlessness and irritability. As the disease progresses, it can also result in secondary health issues, such as heart disease, due to the increased workload on the heart from the heightened metabolic rates. Diagnosis typically involves a blood test measuring levels of thyroid hormones, particularly thyroxine, T4, and a thorough examination by a veterinarian is essential to rule out other potential health issues that can mimic hyperthyroidism symptoms. Treatment options vary, including medications to control hormone levels, dietary changes designed to restrict iodine intake, and in some cases, radioactive iodine therapy that can effectively target and destroy the overactive thyroid tissue. Surgery to remove the thyroid gland may also be an option for some cats. Managing hyperthyroidism effectively is crucial to improving not only a cat's immediate health, but also its overall quality of life, highlighting the importance of regular veterinary checkups to catch this condition early and formulate an appropriate treatment plan tailored to the individual cat's needs. 5. Flea and tick infestations. Flea and tick infestations are common parasitic issues that can significantly impact a cat's health and comfort, causing not only physical discomfort, but also leading to serious health complications if left untreated. Fleas are particularly notorious for causing intense itching and irritation, which can lead to allergic reactions and secondary skin infections. They can also transmit tapeworms, a type of intestinal parasite, if ingested during grooming. Ticks, on the other hand, can carry diseases such as Lyme disease and anaplasmosis, which can have severe consequences for a cat's overall health. Symptoms of infestations may include excessive scratching, biting at the skin, hair loss, and the presence of flea dirt or live fleas on the fur. Detecting these pests on a cat can be challenging, particularly in long-haired breeds, so routine checks and preventive measures are vital. Veterinarians typically recommend a robust flea and tick prevention strategy, which can include topical treatments, oral medications, and flea collars, all designed to eliminate adult pests and prevent future infestations. It's also important to treat the home environment to break the life cycle of fleas, which can involve washing bedding, vacuuming carpets, and using insect growth regulators. Regular grooming can help identify and monitor for fleas and ticks before they become a larger issue, ensuring that your feline companion remains comfortable and healthy while enjoying a pest-free life. With proper preventive care, pet owners can significantly reduce the risk of infestations and protect their cats from the discomfort and potential disease associated with these common parasites. 6. Diabetes. Diabetes mellitus is an increasingly recognized condition in cats, particularly among those that are overweight or obese, with the most common form being type 2 diabetes. This condition arises when the cat's body becomes resistant to insulin, a hormone that is crucial for regulating blood sugar levels, or when the pancreas fails to produce enough insulin to maintain proper glucose metabolism. The symptoms of diabetes in cats can be subtle and often include increased thirst and urination, unexplained weight loss, even with a normal or increased appetite, lethargy, and sometimes noticeable changes in behavior, such as weakness in the hind legs. Diagnosing diabetes typically involves a combination of clinical signs, blood tests to measure sugar levels, and urine tests to check for glucose and ketones. Once diagnosed, diabetes management often involves dietary changes, including feeding a high-protein, low-carbohydrate diet designed to stabilize blood sugar levels, along with insulin therapy administered via injections, which can help to regulate blood glucose effectively. Regular monitoring of blood glucose levels is essential to ensure the cat is receiving the appropriate dosage of insulin and to avoid potential complications such as hypoglycemia. Additionally, maintaining an appropriate weight through a balanced diet and regular exercise can help in managing and potentially reversing the condition in some diabetic cats. With diligent care and regular veterinary checkups, many diabetic cats can lead healthy and fulfilling lives, emphasizing the importance of early detection and intervention in this manageable condition. 7. Upper respiratory infections. Upper respiratory infections are among the most common health issues affecting cats, especially those in shelters or multi-cat households, due to the highly contagious nature of the pathogens involved, which include viruses like feline herpes virus and calicivirus, as well as bacteria. These infections typically present with a range of symptoms, including sneezing, nasal congestion, coughing, runny nose, watery eyes, and loss of appetite, often accompanied by lethargy and fever. Cats of all ages can contract URIs, but young kittens and immunocompromised individuals are particularly at risk for severe complications. Diagnosis generally involves a thorough physical examination and history taking to rule out other potential causes of respiratory distress. Treatment for URIs primarily focuses on supportive care, as most feline upper respiratory infections are viral and resolve on their own. However, antibiotic therapy may be indicated if a secondary bacterial infection is suspected. Providing a comfortable environment with ample hydration, warm food, and perhaps steam inhalation can assist in easing symptoms. Vaccination is an essential preventive measure. Vaccines that protect against feline herpes virus and calicivirus can significantly reduce the incidence and severity of URIs. Additionally, maintaining good hygiene, minimizing stress, and ensuring that cats in multi-cat settings have adequate space can further reduce the risk of outbreaks. Overall, while URIs can be distressing for both cats and their owners, with appropriate care and preventive strategies, most cats can recover fully and return to their playful selves. 8. Arthritis. Arthritis is a prevalent condition in cats, particularly as they age, and it involves the inflammation of one or more joints, leading to pain, stiffness, and a decline in mobility. Osteoarthritis, or degenerative joint disease, is the most common form seen in felines, often resulting from the wear and tear of joint cartilage over time. Cats are adept at hiding pain, so signs of arthritis may be subtle. They may show changes in behavior, such as reluctance to jump, difficulty navigating stairs, less playfulness, or even changes in grooming habits, leading to unkempt fur. Weight gain can also occur as a result of decreased activity. Diagnosing arthritis typically involves a combination of physical examinations, detailed history regarding changes in activity levels, and imaging techniques, such as X-rays, to assess joint health. Management of arthritis in cats often involves a multimodal approach, including pain relief with nonsteroidal anti-inflammatory drugs specifically formulated for cats, joint supplements like glucosamine and chondroitin sulfate, and sometimes corticosteroids to reduce inflammation. Weight management through dietary adjustments and increased gentle exercise can significantly alleviate stress on the joints. In some cases, alternative therapies, such as acupuncture or physical therapy, may also be beneficial. The goal of treatment is not only to relieve discomfort, but also to improve the quality of life, allowing cats to remain active and engage in their favorite activities. Early detection and intervention are crucial in managing arthritis effectively, ensuring that senior cats can live their golden years with comfort and agility. 9. Skin allergies. Skin allergies, commonly referred to as allergic dermatitis, are a frequent concern for cats and can arise from a variety of allergens, including environmental factors such as pollen, dust mites, mold, and certain food ingredients, as well as flea bites, where a single flea can trigger significant reactions in sensitive cats. Allergic dermatitis can present itself through a range of symptoms, including intense itching, redness, inflammation, and hair loss, often leading to secondary skin infections due to excessive scratching and biting. Cats may develop specific patterns of irritation, such as lesions on their ears, face, or paws, which can be particularly distressing for both the cat and their owner. Diagnosing skin allergies typically involves a thorough veterinary examination, detailed history taking, and sometimes intradermal skin tests or elimination diet trials to identify specific allergens. Treatment approaches are tailored to the individual cat and may include antihistamines to alleviate itching, corticosteroids to reduce inflammation, and medicated shampoos. In cases of food allergies, identifying and avoiding the offending ingredient is crucial, while flea prevention programs are essential in managing flea allergy dermatitis. Additionally, maintaining a clean environment, reducing exposure to common allergens, and regular grooming can help alleviate symptoms. For chronic cases, working closely with a veterinarian to formulate a long-term management plan is critical in providing relief and enhancing the cat's quality of life, ensuring that allergic reactions are minimized and effectively managed. 10. Heart disease. Heart disease in cats is a significant health concern that often goes unnoticed until it reaches advanced stages, as many felines are adept at masking symptoms of illness. The most commonly diagnosed heart condition in cats is hypertrophic cardiomyopathy, a genetic disorder characterized by the thickening of the heart muscle, which can impede normal blood flow and result in a range of complications, including congestive heart failure and sudden cardiac death. Other types of heart disease in cats include dilated cardiomyopathy and restrictive cardiomyopathy, though these are less frequent. Symptoms of heart disease can be subtle and may include lethargy, decreased appetite, rapid or labored breathing, persistent coughing, and difficulty exercising. Diagnosing heart disease typically involves a thorough veterinary examination, which may include the use of diagnostic imaging techniques, such as X-rays or echocardiograms, as well as blood tests to assess overall organ function and heart health. Treatment usually focuses on managing symptoms and improving the cat's quality of life. Approaches may include the use of medications to improve heart function, reduce fluid buildup, and control blood pressure, as well as dietary changes to promote heart health. Regular veterinary checkups are essential in monitoring heart conditions and adjusting treatment plans as necessary. With proper management and care, many cats with heart disease can lead comfortable lives, highlighting the importance of early detection and ongoing monitoring to ensure their well-being. Recognizing the signs of heart disease and seeking veterinary care promptly can make a significant difference in outcomes for affected feline companions. Keeping our kitties healthy is a top priority, and being aware of these common health problems is the first step. Remember, regular vet checkups, a balanced diet, and plenty of playtime can go a long way in preventing many of these issues. If you found this information helpful, don't forget to like this video and subscribe for more pet care tips. And share your experiences with cat health issues in the comments below. What steps do you take to keep your cat healthy? We'd love to hear from you. Thanks for watching, and we'll see you next time with more perfect content.